Now, to illustrate what I mean by only looking at one particular problem as being the cause, or one particular cause being the cause of all of these different problems, I'm going to use a little illustration here based on this lamp. Okay, this is my best illustration of a lamp. So this red bulb here represents a light bulb. Let's say that this light in this lamp goes out. Okay, meaning that you can see that there's obviously a problem because there's no light in the room. Okay, now replacing your thyroid hormones is like taking that plug out of the light switch and plugging it into the bottom one. So we change the plug. Maybe the light turns on for a little bit, but if the problem is a short in the wire, or maybe a short from the light switch, then that's not really going to solve the problem. You're going to keep changing the light bulb or replacing the plug until you get the result that you want, that's the light turning on. But if it keeps going out, then you're going to try and find a new plug to put it in. Okay, so when we look at this, we want to say, okay, well, what's the big picture? What's really going on here? So when we take a step back and we look at things a little bit in more detail, we say, okay, well, maybe it's an issue with this light switch. There's a light switch that controls this lamp also. Maybe the light switch is flipped off, or maybe there's a problem with the circuitry getting the signal to the light. Or maybe even further than that, maybe in your house the circuit breaker's off. Maybe you blew a fuse in your house and so you're not even getting power to the room that the lamp's in. Even further than that, let's say that it's a problem with the wires that are carrying the electrical currents to your house. Maybe there's a downed power cable somewhere, and that's causing the inability of your body to get, or the inability of the electric company to get electricity to your house to power that lamp. Or even further yet, let's say it's a problem with the power plant that actually makes the electricity and sends it out to your house. Now, how do we know which one of these is a problem? Well, we have to troubleshoot, just like we do in your body. In your body, when we're trying to find out where the different dysfunction is related to your thyroid, we need to run different tests. We assess your blood, and when we're looking at your blood, we're not just looking for your TSH and possibly your T4. In order to properly diagnose what's really going on with your thyroid, there's about 8 to 10 different factors that we need to consider. So we run all the tests. In addition to that, we take a look at your saliva to see what the function of your adrenal glands are and the current stress level in your body. And we look at your stool to see what's going on in your intestines, to see if the right bacterial flora or the right intestinal balance is taking place. If there's a problem with one of those things, it can cause problems with that present as thyroid symptoms. So we're going to quickly go through these 6 different pathways of thyroid dysfunction. Number 2 being pituitary hypofunction, meaning a decreased function of your pituitary gland. Remember, your pituitary gland secretes this thyroid-stimulating hormone, whose job it is to stimulate the thyroid to produce more hormones. What we'll see is there's a few things that cause pituitary hypofunction. One of those is after having pregnancy, we'll see that sometimes females develop a problem with hypopituitary function, and it's no longer able to properly stimulate their thyroid gland to produce thyroid hormones adequately for their body's needs. Another typical thing that we'll see is once a patient has been on thyroid replacement hormones, when that's not the true cause of their problem, is that their body will say, hey, there's all these hormones here, so we don't really need to stimulate the thyroid gland as much. So what will happen is your body will stop sending that signal as efficiently because it's getting the hormones from somewhere else. So the body thinks, okay, well, these hormones are there, so we don't need to produce any more. Okay. Also, we'll see that chronic stress or an increased cortisol level will do that as well. Okay, that's pituitary hypofunction. Conversion of T4 into T3. So when we look at that, we want to say, okay, well, is there too much conversion or is there too little conversion? And this is topic 3 and 4. Under conversion of T4 to T3 means that your body's not changing T4 into T3 in the peripheral tissues like the liver and intestines efficiently. We remember that 60% of your T4 is turned into T3 in your liver, and 20% of that occurs in your intestines. So when we're talking about assessing your stool to see what the bacterial level in your intestines are to make sure that it's balanced correctly for your body, the goal here is if there's any dysbiosis or a problem with bad bacteria having too much of a balance in your intestines, that can affect this 20% of the conversion of your T4 to T3. Let's say that there's a problem with your liver, where your liver is sluggish or is bogged down trying to do other jobs of detoxification. Since the liver is responsible for 60% of your conversion of T4 to T3, that can cause thyroid symptoms just by itself as well. So underconversion of T4 to T3 is going to be caused by a few things. Number 1 is going to be an increase in your cortisol levels, chronic inflammation, or from underlying bacterial infections, which is again why that stool test is so important. T4 to T3 overconversion. That's when your body turns too much of the T4 into T3. Now you may say, well, how's that a problem? Well, if you don't have the right amount of T4, then the feedback mechanisms that your body uses to let itself know whether or not it's making the right amount of hormones is thrown off. What causes this type of overconversion? Increased testosterone. So hormone replacement therapy will be a cause of that. Something called Polycystic Ovarian syndrome, which is an infertility disease common in women. Also insulin resistance. So insulin resistance is when your body doesn't listen to the signals from insulin to take glucose or blood sugar and bring it inside the cells to produce energy. If any one of those things are a problem, then you'll see that we often have thyroid hormone overconversion, or an overconversion of T4 into T3. The next thing that we'll see is that when there's an elevated thyroid binding globulin, that'll cause problems that will present as hypothyroid symptoms as well. Now, remember we talked about that taxi cab that takes the thyroid hormones from the thyroid and brings them out to the peripheral tissues like the liver and intestines. When you have elevated levels of thyroid binding globulin, that means you have so many taxi cabs that all the hormones are in a taxi cab. When they're in these taxi cabs, they can't get out to have an effect on your body. So they need to be outside of the taxi cab in order to have an influence on your body, or to be turned from T4 into T3. So when thyroid hormones are bound, then they don't do that. So when you have an elevated thyroid binding globulin, you'll see that you have you don't have enough free faction hormones. And so this 60% and this 20% don't happen as efficiently because everything's bound up and locked down so that it can't be turned into T3. Now, things that cause this are going to be hormone replacement therapies for different types of things like menopause. You'll see oral contraceptives. Anything that really raises the level of estrogen in the body is going to drive this type of problem. And the last condition that we're going to speak of, pathway number 6, is your thyroid resistance. We see that thyroid resistance happens when the body has an overexposure to thyroid hormones for a prolonged period of time. When thyroid hormone levels are high, either from inappropriate medication or from overconversion, then you'll see that the body will stop listening to the signal to start metabolism from the thyroid hormones. And this is what we call thyroid resistance. This can also be caused from chronic stress. Again, stress comes in a few different forms. The most common stressor isn't your house, it's not the family, the bills, or anything like that. The number one stressor on your body is going to be your blood sugar. Okay, so if the blood sugar isn't taken care of, meaning that you don't have a diet that's geared towards balancing your body's ability to maintain its energy levels, you're going to see that you can have any one of these problems here. Oftentimes with patients in this office, we see that they don't just have one type of dysfunction related to their thyroid, they have several layers. And that's because most of the time thyroid problems go undiagnosed until they become symptomatic. So these problems have been going on for a long period of time, and once they've been going on for a long enough period of time, then your body starts to be dysfunctional enough that it will present with symptoms, and that's what really gets people's attention. And it's your body's way of yelling louder to get help from you. Okay? So these 6 different pathways, how do we know which one you have? We run the tests. We check your blood, we check your saliva, we check your stool to see what's going right and what's not quite going right with your body. If what I said to you makes sense, I want you to go ahead and call my office, 909-949-0155, and make an appointment to come see me so that we can help you get your life back. Thank you very much for your time, and look forward to seeing you soon.